This is Yeah, We're Going There with Dr. Natalie, breaking the silence on pelvic health for women and men. Yeah, we're going there because knowledge drives better health. Hi, everyone. Today's episode is a really special one for me. I'm joined by someone I've known for over 30 years, my dear friend Josh, whose journey brings a deeply human perspective to pelvic health. At 56, Josh was diagnosed with prostate cancer and underwent a prostatectomy. Like so many men, he found himself navigating the often unspoken realities of recovery, identity, and pelvic floor function. We're opening up an honest, compassionate conversation about what the experience is really like, because this isn't talked about nearly enough. I also wanted to mention just a few statistics before introducing Josh and asking my questions. According to the American Cancer Society, over 330,000 new cases of prostate cancer are diagnosed in the U.S. annually. Approximately 36,000 deaths occur annually. Actually, 1 in 8 men will be diagnosed with prostate cancer during their lifetime, but the risk is based on age, race, ethnicity, and of course, other factors. It is the second leading cause of cancer in men, only behind lung cancer. But the good news is that the death rates are declining. More and more men are now being encouraged to get their PSA levels checked at around the age of 50. PSA is the prostate-specific antigen that helps with diagnosis. So, here with me today is Josh, and I think it's really special that you were willing to do this because I work with men every day who've been diagnosed with prostate cancer, who have undergone prostate surgery, and it's life-changing. And men are obviously very different from women. Women have a lot of girlfriends that they could talk to about these things, and men don't. So that was one of the emphasis that I really wanted to bring this to the public today, so men could have a safe place where they could hear and listen to someone else's experience. So my first question is, if you could take us back to when you were first diagnosed, what were your initial thoughts?
Yeah, so I've always been pretty up with my health. I get blood tests a couple times a year, and one of the things that they measure pretty regularly is PSA, and it's never been zero point 0.5. It's always been like between 1 and 2, which is still considered pretty low. But the recent PSA test that I had about a year or so ago, it went from like a 2 to a 4. And so when they start to see things doubling, it can be cause for alarm, doesn't necessarily mean that it is. So I chose at that point to get a MRI scan, and they found a couple of lesions, which again may or may not be anything. But they rate these lesions on what's called a PIRES score, meaning 1 is nothing, 5 it's most likely cancer. Mine came back a 3, and they looked at it and they said, I don't think it's really anything, but if you want to make doubly extra sure, you can consider getting a biopsy. I had no idea what that even was, so I didn't agree to it on the first, after hearing about it. And as I read about it, I'm like, I'm not doing that. It seemed awful. And so I deferred it for a little bit because it didn't seem really dire. I waited another 4 or 5 months, and the PSA jumped again, another couple of points. And so at that point, I'm like, let's go get the biopsy. And that is no picnic. We could certainly talk more about that if you want, Natalie. I actually found that harder than the actual prostatectomy. Only way to definitively know if there's cancer in the body. And they give you the biopsy and you have to wait 2 weeks. So it's a very long, 2 weeks. And if I didn't have a meditative practice, it probably would have been even more difficult. But, it comes back and you're sitting in an office with your wife in this case, and you're just waiting for the urologist to come into the room. And, there's, I don't know, 25 people waiting in rooms just like me, and she's going office to office. So for her, it's routine. But for me, it's like you're just waiting on bated breath, not thinking anything. And, she comes in and she sits down and she said, you have cancer. kind of. And so you hear that word and you start to freak out. So I lost cancer. You think it's not knowing anything at the time, you think it's like really not good, extremely scary. But then you start to learn about what kind of cancer it is and how aggressive it is, and you start to relax a little bit. But that first initial meeting was extremely nerve-wracking because they rate these cancers on a Gleason scale from 6 to 10, 6 being relatively mild and 10 being more extreme, and the treatment options depending on where yours are. And mine were, at least the first time they took the test, the first read of it was a Gleason 6. So at that point, they basically say, you got a couple options, and this is all within 20 minutes. So your mind is like not hearing anything
Of course.
in that first meeting. So, active surveillance, I didn't know what that was. Radiation, I didn't know what that was. Prospectomy, what she said, and she recommended not doing anything. And that was the first time I heard it. And I kind of left there just like not knowing anything and just sort of like in shock a little bit and not knowing really what to do. That was the first, time I heard about it.
And so when you went home, what did you do?
ChatGPT. So I
Of
took
course.
I
Yeah.
took the biopsy and I uploaded it to ChatGPT, and we can go into more details if you want. But they did 12 samples, and there's a couple of different ways that they can sample the biopsy. One's called targeted, which is where they take the samples from the actual lesions, and one is called random, which is what it sounds like. They just take 12 random cores, and they're trying to determine the aggressiveness of the cancer. So I had a random biopsy done. She took 12 cores. Of the 12 cores, 8 of them came back cancerous, and on a scale of 6 to 10, they were Gleason 6 on that initial read. But ChatGPT suggested that I get it read a second time because these tests are somewhat subjective, and the difference between a 6 and a 7 is material with regards to treatment. So when it was a 6, I was pretty happy. However, there's nuance here, because if it was a 6 and only 1 or 2 lesions, then it would have been a no-brainer. You wait and watch, because the treatment options are not good in terms of the after effects that could be. It's not like you have a broken wrist and it heals. These are big things that could happen to you, specifically around erectile dysfunction and incontinence. So if you can just watch and wait, sometimes you can do that your whole life and never have to do anything if you have 1 or 2 cores of a Gleason 6. I, on the other hand, had 8 of the 12, and some of them were at 80%. And so I was on the fence here. I was an edge case. If I had a Gleason 9, you got to get treatment. If you have a Gleason 6 with 1 or 2 cores, you don't have to do anything. I had Gleason 6 with 8 cores, so I was kind of on the fence. I had the biopsy read again by Johns Hopkins, and they had a different perspective on it. They said, well, you have 6s, but you also have a 7 over here. So that kind of tipped me more over to treatment. And then you go down that rabbit hole, and you, to make a long story short, have 2 forks there. One of them is radiation, something called CyberKnife, which we could talk about. And the other one is surgery, which is a radical prostatectomy. And they both have their benefits and drawbacks. And we can certainly talk into the decision-making process that I use, but it's a very nuanced and personal. It's on a lot of different factors, and there's not a right or wrong, but we can certainly, get into that if you want.
Did the doctor, so I'm assuming that the doctor discussed all the potential side effects of everything, especially around bladder function and sexual function with respect to radiation versus surgery. And I'm guessing that played into your decision of which way to go.
Yeah, well, the first thing that I was mostly concerned about was getting rid of the cancer. Like from just a mental perspective, I wanted it like out of the body, like completely out of the body. And so just before I delved into it too much, I'm like, okay, if you really want it out of the body, you cut it out and it's out of the body,
Right.
assuming that it hasn't spread. So there's sort of like a cleanness to it, at least in my mind. I'm like, okay, I'm done with that option. The radiation, if you get it and it comes back, they can't take the prostate out. It's a little messier. However, it's easier in the beginning.
Right.
They radiate you and you're home the next day. But as time goes by in the radiation, you can start to have some more of these side effects in 5 to 7 years. Surgery.
Because the tissue fibroses.
Yes. Yeah. It's sort of a longer draw. So if you're 70 or 75, the radiation is much more attractive because you're older, but I was 56.
Right.
So the surgery, much harder in the beginning, easier as you progress. And those are the 2 big ones, erectile dysfunction. I was much more concerned with the incontinence and the surgery, and seemed to have more of a risk of that than the radiation. So I was tipping toward the radiation for a very, very long time until I stumbled across a gentleman by the name of Dr. Ted Schaefer, who studied under Schwartz, who was the guy who invented this procedure. He's at Northwestern. He's one of the top guys in the world on all things prostate. And he was agnostic because he's a multidisciplinary guy. And ultimately, what I have found is you have to pick someone that you're going to trust. That could be a radiologist, and it's a gut feel. So I certainly talked to some top radiologists, but when I met with Dr. Ted Schaefer, who's part of Peter Attia's, cohort, Peter Attia being a longevity doctor, and I met with him for an hour and I read his book, literally a book on this. And after speaking to him, I was 100% confident after that conversation that I wanted to get it removed.
Okay. And what was your experience, I guess, going through surgery, both physically and mentally?
Yeah. So before the surgery even happened, once I made the decision, because I wanted to give myself the best possible chance of not having incontinence, I treated this like training for a triathlon.
Right, which
So
I know
I've
you've done many.
done some triathlons. I'm like, what can I do proactively? Because this is what was interesting to me, Nat. All the stats that I read were not people like me.
No.
So when I don't mean to, boast myself up or something, but I'm someone who aggressively cares about my health, and I train, and I'm very proactive. I'm not sitting on a couch, woe is me kind of thing. I'm like, what can I do proactively? And I heard of something called pelvic floor health. Now, I had never heard in my life of anything called pelvic floor anything.
You didn't know I did that?
No, I had no. Jenna mentioned, my wife mentioned it to me, but I had no idea what it was. I had no idea. Went down the rabbit hole, and I talked to you, as you remember, and as you know, you can start, and you were very helpful with this, you can actually start to train your muscles to reduce the risk of having incontinence. I'm like, that sounds great. The surgery wasn't for 3 months because the top doctors, it's a 3-month list to get to see a Dr. Schaefer. So I go, great, I got 3 months to train for this triathlon.
I love it.
And I went and I booked weekly pelvic floor training, and I did the exercises every night at home for 3 months. So I went in strong mentally, and also like I kind of got the lay of the land. And to just give you the punchline here, there was not a drip after the surgery. Some people have to wear pads a little bit or whatever, or whatever. And sometimes, but for me personally, from the time I was out of that surgery, when the catheter came out and I was in that, we can walk through that experience, and they took the catheter out and they basically flush some liquid down, and they want you to see if you can hold it.
Mm-hmm.
From the time I left that office, and I had the diapers like prepared and everything.
Right.
And when I say not a drip, I mean not a drip. From the time after that surgery till today has been 3 months. It has been a non-issue. That certainly speaks to the surgeon. We can get into that. There's a couple of top people that do this nerve-sparing surgery. Of course, that matters. But also, I believe the training that you helped me with was instrumental in that not being a factor at all. Just wasn't. Now, I certainly thought it was going to be, but it just was not a thing.
Right, which is, to me, blows my mind. Because, I see men every day post-prostate surgery, and this kind of just reinforces in my mind that doing the prehab or the therapy before the surgery can change the whole experience. One of the difficulties is that not all urologists send their patients for physical therapy unless they have a problem event, like it's 6 weeks later or 3 months later, they're still having leakage. At that point, they're sending their patients. But it's hard to learn to do all those exercises when the dysfunction is present. It's harder to learn. I don't know if you felt that way, that your mind-body connection beforehand made it easier afterwards.
Yeah, so my urologist said the same thing, that they did not recommend doing this, but I didn't care. I'm like, I'm going to go do this anyway. And you're 100% right. So at the same time this was happening, I was introduced to someone who had gone through this, and he had recommended yoga, which was not on my radar at all.
Yeah.
He mentioned someone in Boca named Leslie Glickman, who I had known or heard of, some yoga thing. And he's like, you should go see her.
Yeah, she's fabulous.
And you know Leslie?
I used to take her classes when I lived in Florida.
Okay. So this is
and
interesting.
I worked there. I worked at the same place she did. That's how I met your wife.
Oh my God, what a small. Okay, so you're gonna love this story. So he's like, you should take a private lesson with this Leslie. So this was about 3 months before the surgery, and I meet with Leslie one-on-one, and within 20 minutes, and I you know her, so you could speak to this. There was this feeling that she understood everything that I was going through, and this yoga that I started doing was magical in just calming the mind down. And I'm not a yoga person, but within the first hour, I'm like, oh, there's something here going on here. And I don't know why it does what it does, but the combination of the yoga and the pelvic floor exercises, and I was going to yoga every day, 6 or 7 days out of private with her once,
Huge.
huge. And that was 3 months before. So by the time the surgery came, mentally, plus I had also done meditation before. I had also done some psychedelic journeys before. So I was kind of in this mindfulness thing. Like I was pretty prepped for what was going on mentally. And so I think the combination of the yoga and the exercises was instrumental in getting me into the best headspace.
That's amazing to hear. And I'm not surprised, honestly. I find that in our field, we do recommend a lot of yoga
Huh.
because there's all the breathing techniques that calm the central nervous system, that in addition to calming the central nervous system, allow those pelvic floor muscles that you can't see to relax and lengthen, so that when you are doing your exercises, you're actually working through the full range of motion versus trying to squeeze an already tight muscle. So you're getting a lot more out of it.
Yeah, and what was interesting was Leslie. I'm like, Leslie, what's a pelvic floor? And she was so like, I literally didn't know what it was. Like I know biceps, triceps, like quads, like what guys would know.
Right.
So she was so good at, because it's not something you can go like this and flex. It's a very subtle muscle,
Right.
She said to me, she goes, you have to pee. And you just like, you stop the pee midstream. I'm
Yes.
like, I don't think I've ever done that. She goes, do you
But
have
I
to pee
want to
now?
ask you a question. You don't
Yeah.
really do that in real life, right?
No,
You
I've
don't
never.
practice
So I said to her,
that way.
I go, I've never done that. She goes, you never stopped. She goes, do you have to pee now? She goes, go pee and then come back and like. She goes,
Okay.
so I went and I did. I'm like, oh. She goes, that's the muscle.
Exactly. But I want to preface for anyone who's listening to this, it's a visual. So like I use that visual with a lot of patients. I'll say, imagine you're urinating and you're trying to stop the flow of urine, and they do it. And I'm like, that's a Kegel. The thing is it's imagery. You never really want to do it when you're actually peeing, because when you're peeing, your muscles know that they have to relax. And if you're trying to stop the flow of urine, you're messing up that reflex.
That's right.
And another way I teach it to my male patients, because they don't all get the stop the flow, is I'll tell them, try and shorten your penis. And that will often click too, because you're just kind of pulling it in,
Yes.
which could work. So you have to just, whatever visual works.
Yes. Once you understand and feel the muscle, then okay, I'm doing it right now. Like first I thought I could do this anywhere. And I got an app called Squeegee, and all it does is it's Squeezy or something. It kind of times you, because I was doing different reps of it. And then when you went to what was interesting was when you went to the therapist, and they hook you up with, you would know this, electrodes, and you could see it on the scale.
Biofeedback.
Biofeedback. So you see it. So I love stuff like that. So I had to hold it and then come and, release and hold it. And you could actually see it working. And it was at first very awkward, like just really awkward. But I'm like, okay,
it takes coordination.
It's certainly easier than doing mountain climbers. Like certainly easier than getting kicked in the water, and certainly easier than an Ironman. Like
right.
I'm sitting in a chair in air conditioning, like, okay, it's awkward, whatever, and the waiting room, it's all like elderly 80-year-old people. But but that's your mind, so you use your yoga practice. And like after a while it becomes routine. And you're like, okay, I guess I'm doing all that I can do to get myself into the best position that I can be in.
And the beauty of the exercises is, yes, they strengthen the muscle to help you control urinary incontinence, but they also could potentially help bring more blood flow to the area to help with healing and help with an erection and orgasm and all of that. So people who are struggling, this helps as well. My next question, actually, you already answered. I was going, how did you learn how to do a Kegel? So I love that it was Leslie who taught you. I think that's really cool. Did you have any residual effects after the surgery?
Yeah. So this is kind of interesting. So the two big ones. So no incontinence at all, like zero. The erectile dysfunction. So I'm able to get erections, and it's only been, I want to preface this, it's been 10 weeks, 12 weeks out since I've had the surgery. So this might change. My desire for having intercourse has lowered. I'm able to get the erection, but mentally, my desire has waned, which from what I understand, a normal kind of a thing, able to, but mentally you're sort of like still navigating this area. So that might get a little bit better as I get on. But I've also noticed, like with my wife, this was a kind of this is interesting, Natalie. There's almost a silver lining to this that that I would never have had experienced if I didn't have this. So I'll give you a couple of examples. When I say silver lining, I mean positives that have
Of
come out of
course.
this. Positives that have come out of this. So one huge positive that would never have been on my radar that has made my life infinitely better has been this yoga. Like this has just been phenomenal in every way. The second one is my definition of intimacy was very narrow for the surgery. It was like, okay, it's intercourse, I guess. It's like intercourse. But it turns out that you can be, and we don't have to get into so much detail, but you could be very intimate with someone without actually having intercourse with someone, even in a somehow very satisfying ways that I would never have explored if not for this. I'm sure I'd still like to have intercourse and all that stuff, but there's also like, it's not the only way you can be intimate with someone.
And I feel like just having you had said that will help other people who that's a huge fear for them.
Yes. Yeah. So the erection came back, but I've noticed like I don't have the desire that I had before to actually have, intercourse.
Well, the whole
I guess,
experience was traumatic, I'm sure.
yes.
Anyone who has cancer, it's a trauma.
Yes. And that's why the mindfulness practice, the meditation practice, the yoga, because the mind, if you don't have a meditative practice, what happens is you have these thoughts and then you are constantly the slave to the thought. So you have the thought and then you feel the way the thought feels. The thought is dictating your life. If you have a meditative practice or you do yoga, the muscle that it builds, to me, the superpower that it builds is that you can actually be aware of the thought. And when you're aware of the thought, you're not a slave to it. You're not caught up in it. You're just looking at it. And when you look at it, it just sort of like loses its strength. You kind of look at it and like, oh, there's that thought. And then you think of something else. And that just sort of like calms the whole thing down. You just sort of experience things and it's like you're the sky and you're kind of seeing these clouds versus getting caught up in the weather.
Right. It calms the central nervous system. It takes you from that fight or flight to a more rest and digest.
Yes.
And all those types of treatments, meditation, mindfulness, yoga, they're great for anyone dealing with anxiety, anyone dealing with pain, because our brain and pain are so intimately connected, and fear and anxiety. So I'm like so happy that you found that. I think it's huge.
It also has a way of recalibrating what you prioritize. So I'm 56 and I noticed like even with work, I'm like, well, I don't want to do that anymore. I'm a solopreneur, but I'm like, hey, I'll get the speaking gig. And I'll be like, you know what? I don't think I want to do that right now. It's not going to change my life any financially. I'm going to still be able to, do yoga and go on vacations, but the extra $25,000 isn't going to change my life. I think I'm going to not do that. And instead, I'm just going to not have to prep for it. And I'm just going to go do yoga or play the guitar or some other thing. Got into guitar more, started doing watercolors more, got in like I mentioned, the yoga, doing a lot more walks.
Love it.
So I've sort of like valued my freedom of time more than the money and kind of came to this realization that you could always make more, but I kind of was like content and I have enough. And this, I've heard from other people that I've spoken to, they've gotten to other things. Maybe they volunteered or started to give back in other ways. Again, these are like silver linings of things that you wouldn't think, but these things would not have happened if not for this diagnosis. Yeah.
Right. Is a goal of yours to get back to your triathlons?
No, I don't have any desire for that. One of the realizations that I came to in doing the mindfulness and the psychedelics and even the yoga was that I was abusing my body a little bit too much with those. And it was my ego's desire for validation, having a picture coming across the finish line and having the attention on me. Even when I was looking at the pictures, I mean, it's something I talked to Leslie about. I got a little emotional about it, but I think I can keep it together here. There was a picture of me that I was just looking at and, I'm in the hospital and I have all these IVs and I'm with like a thumb up. And in that realization, I'm like, even in the hospital, I'm trying to get people to say, look at how amazing I am. I survived this and I have all these IVs. And I'm like, look at what this is doing to my body. The body is giving me a signal like, dude, you have these pictures of you can't breathe. You're getting an IV across the finish line. You're hooked up to saline and now you're in the hospital. And I kept going and I kept going. And Leslie said this, and I think she's right. She's like, there was these signals coming at you and you kind of needed this other signal because those weren't enough. You needed this other signal of now you have cancer, albeit as a 6, it's not a 10. And maybe this will cause you to reflect a little bit. I think Oprah Winfrey says something like this, and I'm going to butcher it, but like the universe, and call it whatever you want, throws a stone at you once, another stone, and then a rock and then a brick wall. And that is certainly what happened to me. I look back at these pictures and I'm like, what was I doing? Because there was signs all along. When I was doing the shorter triathlons, it was fine. But then the ego's like, oh, I did this one. I got to do a long one. Now I got to do an Ironman. Now I got to do 26 miles. Now I got to do it. And you get caught up in it.
Yeah,
and
there's
you
a bit
can't
of an
see it.
addiction there when it's a high that you get.
It's a high and it's validation and it's the ego. And you
Right.
get caught up in it and it becomes, you're the center of the universe. Look, not fun for my wife to go to Mexico and lose track of me on the tracker for 4 hours and I'm in the hospital because
Right.
I'm biking 110 miles. Like you can go bike, but you don't have to bike 110 miles. You can bike 50, you could do a 2-hour race. So it's not really, it's for me at least, it became apparent it was also very selfish.
And talking about Jenna, how did she deal with your diagnosis and everything?
So I saw another side to my wife that I had never seen before. She was at her best when I was at my worst. I mean, she
I just got chills, just FYI.
was like a super person.
Yeah.
Like when I was not able to keep it together, she was like on the phone with people, like taking care of stuff. And like, even when I came home, like she had a retractable bed in the room and she had the pillows all in the right places and there was water and it was not, the catheter, it's a rough couple of weeks, man. And the surgery thing, and she was there and she was like at her best. And it can get a little, it's a private area. It's an area that men aren't used to being exposed with. And she was there helping in all sorts of ways where I wasn't comfortable with. And you wouldn't think that it was not even like a big deal. Like she took it in stride and was just like at her best. Like she would have been an amazing nurse. She was so, I mean, it's just, there was no possible way I could have gotten it through without her. And I just had such more love and appreciation for her, even more so than I did when seeing all that. And I felt also so bad that she had to go through it, but that was my own thing. She was like, dude, this is what I'm going to help you through this. We're going to get through it.
If I remember correctly, she's the one who reached out to me to talk to you.
Yes.
Is that right?
Yes. She's like, you need to talk to Natalie about pelvic floor stuff. I'm like, oh yeah, I remember that vaguely. And yes. And that's when we spoke.
Right. No, I know. It's like, it's a great way to see the strength in your partner when you never knew that existed.
Yeah. And I think by and large, women are better at like the nurses that I had. I mean, just the way, the things that they have to deal with the grace and the compassion. They're dealing with like bodily fluids and you're at your worst and they're at their best. Right. I mean, my wife was just at her best moment, just incredible, honestly. So if you have prostate surgery, call my wife, have her come to your house. She's amazing.
I'll make sure to let everyone know.
Yeah.
And what about talking like to friends? Like was it awkward, like telling them what's going on? And
I realized pretty quickly that it makes people very uncomfortable to talk about that. Men, very uncomfortable to talk about that area. Like you can sense it within 2 seconds. Like the people that I spoke to really were the ones that had gone through it. There was one guy that Leslie introduced me to, this guy who's also a yoga person at her studio that had gone through it. And he was extremely, extremely helpful talking to me when I was trying to go back and forth with different options. And I still talk to him. There was a group that I had joined for a little bit, talking to other people that were kind of going through it. So yeah, talking to like people that don't have it, it was just very burdensome to them. I felt, and that could have been just my ego, that it made them uncomfortable. I sensed that it made people very uncomfortable to talk about. They didn't want to like
probably scared
think about it.
Because
they didn't want to think about it.
It's the whole thing is super scary, especially if you have a family member who's gone through it and didn't have as good an outcome maybe as you did. That's what they saw and that's what they remember. It's hard to think about. Yeah. And there's no shortage of things with bad outcomes. If you go looking for it, you'll find it. Like there's people on the internet and YouTube that have bad outcomes. Some of these things are scary. Like the thing that was steering me away from the surgery was the catheter. Like first off, I didn't exactly know what that was. And then when I learned about what that was, I'm like, I am not doing that. That was the first reaction. But fortunately I did yoga and meditation. And I was like, who is that making me say that? Well, that's some preconceived notion of what this thing is. And so I had like 2 or 3 weeks where I had to say, okay, what is it really? Okay, it's a tube that's coming out of the urethra.
that's meant to do this thing. And all the other stuff around it is all my own baggage of all these things I'm making it that it's going to. And here's the thing. It wasn't anywhere near as bad as I thought it was going to be. And certainly nothing like the biopsy. Like it really, once you get past the, oh my God thing, it wasn't really painful at all. It was a little like weird looking, but it wasn't anywhere near as painful as I thought it was going to be. And the same thing with the surgery, not as painful as I had envisioned it to be.
So what made the biopsy so much worse in your mind?
That was extremely, for me, that was hard. The first thing with the biopsy is you're not under anesthesia. So they give you laughing gas if you want it.
Did you take it?
Yeah, I did. I took it, but
Yeah.
it's not like when you go to the dentist, and it feels like a staple gun. So it's a little uncomfortable, but nothing unbearable. And they do it, you feel 12 clicks and they're talking to you about it. But the afterwards of that for like, I want to say 3 or 4 months, 3 months, 3 months at least, the blood in the urine and the blood in the semen is like, fucks you up mentally. I remember this. I had sex with my wife like a couple weeks after, and the semen is red. First off, I didn't even know that was a thing. So I do this. I'm like, holy.
No one warned you.
No. And she sees this and I see this, and she's obviously freaking out. She's like, what the F? And I'm like, I'm so sorry. I would never have known. So now I'm like, I don't want to do that again. So now I'm testing it out beforehand. Like, okay, let me just test out the semen before we do this again. Like, so I'm testing it out.
That's trauma in itself.
Oh my God. It was awful.
I'm sure is still the whole thing, you know,
the whole thing. Yeah. So that went on for like a while. And it was just an awful experience. Yeah, that was not good. But unfortunately, it's the only way to definitively know if you have cancer.
Right.
In the prostate.
Right. Because the PSA levels tells them, yeah, it's high, but it could be prostatitis. It may not be cancer.
That's right.
And then I know they check it every few months, and that's what they're looking for. They're looking for a fluctuation or an increase. If it's a rapid increase, that's concerning. And that's when they typically do the biopsy.
Listen, now it's been 3 months. So after 3 months, they test your PSA again. So when they do the prostatectomy, one of the advantages of having the prostate out versus radiation is they can test the gland. So they can see if there's been any cancer on the margin of the prostate, meaning is it spreading outside the prostate? They can test to see if it's a positive or negative margin, and they can also test the lymph nodes. So you're now waiting 5, 6, 7 days after the prostate surgery to get those results, and you go to the office and they come in and they give you those results. And mine were negative margins, negative lymph nodes. So you think you're like, oh, you think you're done.
No, but it's still, it's better than the alternative.
Yes, it's better than the alternative. So then they test your PSA. Mine is going to be tested 3 months after. So next Tuesday, they're going to test the PSA. And the PSA should be less than 0.1. So 0.001, 0.002, less than 0.1, which means there's no detectable cancer anywhere in your body. You would think that you got the prostate.
How do you feel about that upcoming test?
If I didn't have the meditative practice and I didn't have the yoga, I would be spiraling and probably be depressed on the couch. And it would certainly be all consuming. But I'm just now that we're having this podcast, we're talking about it. But I went the whole day, like, this is huge for me. I went the whole day up until just now. It's next Tuesday. I haven't even thought about it.
Which is huge.
Because of the work with Leslie.
Fabulous.
Now, I don't know if all yoga teachers are like this. From what I hear, she's a special snowflake. But
she is special.
Yeah. So because of the work that I've been doing with Leslie, it's this thing that comes into my mind, which is this, with working with Leslie, is right now today, is there a problem with your PSA? So we said during the one-on-ones, I'm like, no. And then she said, the cancer that was there is now gone. That's what we know. The cancer that was there is now gone. And right now in this moment, is there a problem with your PSA? And the answer to that question is no. Like right now, this second as we're talking, no. And so when I ask myself this question every day, right now, is there a problem? Like in this particular second, in this particular moment right now, is there a problem? The answer is no, not right now, but maybe, not maybe.
And you can't focus in the future. You can't perseverate and have that thought.
Well, you can.
That'll make you crazy. You can, but you don't want to because it'll make you crazy.
Yes.
And you're super lucky that you found a solution to help you with that, to be in the present.
Yes. And that's the work with that. And that's the work, which is the breath work and the coming back to, is there a problem now? So you got to test it on Tuesday. and then you get information.
Right. And you take it from there. There's nothing you could do about it now.
That's right.
So, and so you mentioned you like talking to some people that have already had it. Is there a place? Is there a Facebook group? Is there anything out there that is a community that people who are going through this that you found that could help them talk to them, explain everything to them, so be a support system?
Yes, there's a bunch of different places. So there's I can't remember the name of it. There's a prostate hotline. There's a number.
For real.
Yeah, and you call it, and people that have had prostate cancer call you back on the phone. And you can call as many times as you want. Talk to them.
Wow.
And they're fantastic.
How did you find them?
Google.
Wow.
Searching, you could find it pretty easily. There's like a 1-800 number, and they'll talk to you as long as they want and as many times as you want. That was extremely helpful when I was going through this decision-making process. There's also the University of Miami Health, which is where I had my surgery down in Miami. They have a whole support system group there. There's lots of different, groups. The one thing that I would caution you about is it's also nuanced. Someone else's experience might not be your experience, and your brain is very good at thinking of the worst of everything, and so you have to really work hard to sort of step back and think, am I getting wrapped up in my thought and my stories that I'm telling myself about these things, or can I kind of drop back and look at this in a more objective manner? So that was it's a 3 or 4 month process that you have to make a decision. So it's not something. The good thing about prostate cancer is it's not a fast growing cancer.
Right.
There's no rush here, or whether you wait 4 or 5, even 6 months, not going to change anything. So you have time to slow down and consider all your different options. But yeah, there's tons of people you can speak with. I also had a great conversation with Ted Schaefer in Chicago. That was like an hour-long conversation, read his book. But ultimately for me, it came down to, like, Leslie's a good example. I found Leslie, she's my yoga person.
She sounds like she's a therapist, to be honest.
Therapist. Well, there's Ted Schaefer. Like when I saw him on YouTube, I'm like, it's a feeling. I also saw some Cyberknife guys on YouTube. But when I saw Ted Schaefer on YouTube and I listened to him on Rich Roll, and I read his book, I'm like, that's my guy. It's a feeling. It might be different for you. But when you pick your guy or your girl, that's who I'm going to trust. And then it became, who do I want to have do the surgery? And he would have done it. Do I want him to do it? But he was really forthcoming. He's like, the guy in Miami, Gonzago, I went to school with him. He's freaking awesome. And it'd be much easier for you to have it in Florida in January than Chicago.
Right.
And the guy's just as competent. And so that's what happens. You'll find that you'll find your person.
Right.
After 3 or 4 months, that's my person. And then you just trust that person.
And what would you, if you could tell a man now, either just getting a diagnosis or awaiting surgery, what tips would you be able to give them? What would you recommend or suggest or wish you had known that maybe you didn't know?
I don't think there's a better gift you can give yourself than having control of your mind and your thoughts. So there's lots of ways to work on that. Meditative practice, mindfulness and yoga, because that is a superpower.
Yeah.
Because if you are not aware of your thoughts, which is 99% of people walking the earth, you have a thought and you just do the thought, you're reactionary. You have this thought and you spiral, and you don't even realize it. You're just on auto program. But if you're able to have this awareness of your thoughts and look at them and observe them and witness them without judging them and be even compassionate to them, you can make choices that you could not make if you were not aware of your thoughts. Because if you're not aware of your thoughts, you're deciding without even knowing you're deciding.
Yeah. Right. It sounds like cognitive behavioral therapy, honestly.
Yes. Or IFS,
yeah.
Internal family systems. You're sort of like looking at the parts of yourself. And, all these parts are protectors, but they don't have to guide your decision. You still may choose that, but you can actually kind of drop back and be a little bit more thoughtful and less anxious about the process.
And what advice would you give men who are going through what you went through, but it's not in their comfort zone to talk about it or to seek help? I mean, you're not the norm, I have to say. You're open more so than most men. Most men are especially uncomfortable talking about their pelvic health.
Yeah. So this is again, this gets back to a mindfulness practice, because when you're uncomfortable talking about your pelvic health, that is a part of you, an ego part of you that is trying to protect you that is based on something that happened to you in your childhood or things that you've experienced as what you think a man should be. And so if you're not aware of this and you're just acting on it, that's going to drive your life, and that's okay if that's how you want to be. But if you have a mindfulness practice, or you've done a psychedelic thing, or you've done yoga, you've done some work on this, you can see this as a part of yourself, not to push it down. It's not bad, but you can be compassionate toward it. You can say, thank you for protecting me and not making me a fool of myself by talking about my pelvic health to my friends when I was in high school, because I would have been an outcast. You've been amazing. Thank you for that. And I love you for that. But right now, what I'd like to do is not have you drive the bus. I'd like you to go to the third seat of the bus, the third row. And I'm going to see if there's anybody that I could reach out to talk to about this or have a conversation with about it. And so in that moment, you can actually have a choice as to whether or not you want to listen to that part of yourself, which again is not a bad. There are no, if you do internal family systems, and it sounds like you're versed in this, there's no bad parts of you.
Right.
These are just parts that have protected you, but you have this compassion and love toward it. All of a sudden, what you see is like, oh, that's okay, that's over there. And now it opens up this other area that you can choose if you want to go down, versus before you didn't even have the choice. So again, to me, it comes down to this mindfulness practice. And you may still choose not to talk to anybody, but at least now you have another option to explore if you have a mindfulness practice. But it's like working out at the gym. You can't read a book about it. It's something, I do the meditation every day and do the yoga every day. It's like, it's a muscle that you have to work, and it takes, 30, 60, 90 days to start creating this sense of awareness of your thoughts. So it's, I think yoga, they call it a practice for a reason. It's a practice. There's not a destination to it. It just is a daily practice.
So the big thing I'm getting from you is that meeting Leslie, working with Leslie, doing the yoga, doing the meditation and the mindfulness has made the whole experience more tolerable, more manageable, a little less scary. So, you're young, you're 56. Typically, this is diagnosed at a later age. I see it, a lot of my patients are older, 70s, 80s. It's a different decade, not the same openness. My only hope is that maybe they hear this and they stop and think and not feel that they have to be so macho and they could talk about it. It's funny, I sometimes tell other coworkers that I love my male patients because they don't want to be there. So they really listen to everything I tell them, and they're fabulous. They go home, they do everything I told them, sometimes too much, versus my female patients who, well, I didn't do my exercises. So it's just their discomfort makes them have better results faster.
I could
they
see
don't want
that.
to come back.
I could see that. Yeah, I mean, look, it's also like finding the humor in it too, like, and also being like, the thing is like that you learn from the yoga, like even today we did this thing with the yin class with Leslie, and she said something that was like remarkable. She goes, how amazing it is to just be able to breathe. We did breathing for like an hour and 15 minutes. Yin is a very slow, stretchy kind of yoga, not very physical, but you hold these poses for a while. And her cueing was like, let's just focus on the breath. And what a gift it is to just know. And she was explaining it way better than I can about what's involved in just having a deep breath. And you start to have this gratitude, like, oh, I can have this deep breath today. I don't have pancreatic cancer. Like there's a lot of things. I don't have ALS. Like,
oh gosh, yeah.
I can take a deep breath right now and really stay right now in this particular, like this second, this moment. Even if you have been diagnosed, like right now today, is there really a problem like that you can't do? Like, can you breathe? Can you walk? Can you go for a beach? You don't really know. Like, even when I had this, like, you don't feel any different having it. You can still go for a bike. You could do all the things. It's your mind that makes it feel different. Your thoughts can make it feel very different. But like day to day, you can still do like I was doing yoga until 2 days before the surgery. Like I felt you would never know I even had it. I would never know. So this idea of like gratitude, of being able to like take a breath and knowing that there's a million people that would consider their prayers answered to have Gleason 6 cancer.
Right. It's a great attitude. It's a great way of thinking. And with all the decisions you had to make, because there were many, you had different options. How do you feel about the path you took?
Yeah, so that's a really good question. I've been asked this in different aspects of my life. Like, hey, Josh, when you were thinking about doing this job or this job and you chose this one, how do you feel about the path? I don't think there's a wrong choice because you always think the other choice might have been better or different and you don't know. So you make a decision and that's the choice you make. And you can't think that, well, even if that decision goes not as well as you thought it would be, you don't know if the other choice would have been better or different. So you take all the information in and you make a decision based on your muchly like your gut and feel. And then you're like, that's the decision that I made. And even if I had a little incontinence or other issues, I'm like, that could have been worse the other way. I'm not going to ever say I wish I would have done X or Y or Z, because you don't know
Right.
what X or Y or Z would have been anyway. Could have been way worse, So no, I don't have any regrets or didn't like second guess myself at all. I will say this: the surgeon does matter.
Of course.
So I mean, there's people that have done this a lot, and there's people that are known. Like Ted Schaefer's probably the best in the country at this, and then there's people in his inner orbit that are very good at doing this, what's called nerve sparing surgery. If you're in your 70s or 80s, doesn't mean the radiation might be a better choice, but there's also people that do radiation well, just like in any field, there's top people. So I'm not saying haphazardly go and just get it treated. Do the research on that as well.
Yeah, I think anytime and you do any type of surgical procedure, to do as much research as you can, to speak to as many people as you can, to speak to as many physicians, get as many consults.
Yes.
And number one, like you said, it's a gut feeling. Who do you feel the safest with?
Yes. Yes.
Because
and for me, there's a Dr. Gonzago, like when I met him face to face and in person and referred from Ted Schaefer, I'm like, oh, because I met with like 3 other people before him that were surgeons. But when you meet him, it's like when you meet a girl or a guy, like, oh, there's my,
Yeah. Well, thank you so much for doing this. And I wish you so much luck for Tuesday.
Thank you, Natalie. I appreciate you.
I just wish you all the best. And I'm just so happy that you've had such a positive experience. I mean, maybe a little bumpy here and there, but overall, you look great. And you're the new you.
Yes. And we'll end this interview, but I'll show you my penis. No, I'm just kidding. We're not gonna do that. That is not this on. Sorry.
Wrong show.
Wrong show. That's my OnlyFans page. You can go see that.
Okay.
Josh Brown OnlyFans page.
Josh, thank you so much.
Thank you, Nat.
Talk to you soon.
Talk to you soon.
Thank you for listening to Yeah, We're Going There with Dr. Natalie. If this conversation helped you feel more informed or less alone, consider subscribing, leaving a review, or sharing the episode. Until next time, yeah, we're going there, because knowledge drives better health.